This is Nurse Brittany at Forsyth Plastic Surgery. I have Dr. Branch.
Hi.
And our patient, Dr. Juan Savage, who is also my husband. And he is here to get his very first Botox treatment.
A few questions I usually ask everyone. Why do you want Botox? So what brought you in today?
So, getting a little bit older now. I'm like in my mid-30s. I know it's maybe not too old, but I'm starting to feel some of the kind of wrinkles on my face. Like, I work on the computer a lot, and so like find myself squinting at the computer, and I'll feel some of those lines, and I know they're kind of just digging in. So, yeah, so that's probably the main reason.
And have you ever had Botox before?
So this is my first time. I really have no idea what to expect.
You're welcome. And a lot of the stigma behind Botox, I feel like a lot of the men are a little more hesitant to come in, but once they do, they love it just as much as the women. And probably need it even more because their muscles are that much stronger. But usually what I tell people, you kind of raise your eyebrows, you'll kind of see the wrinkles in the forehead, how thick and active his muscle is, and then if he relaxes, you see these kind of creases that are left over behind. So over time, those get deeper. If you start Botox earlier, then it can prevent those permanent lines from forming. So forehead, in between your eyebrows, and then usually what I call the little crow's feet, or the ones kind of around the eyes as well, are the best places for Botox. Also for migraines, it helps migraines, headaches, sweating on your forehead as well. Usually it says it's not that painful, a few shots, not a lot of downsides as far as you have a week, as far as it takes until the Botox really kicks in. Just take it easy today, no exercise, don't
Sure,
do a lot of sweating, then everything's back to normal. And you'll see the effects last about 3 to 4 months.
Cool.
You'll feel a little pinch and burn. You'll hear this little crunching, which is normal, which just means it's going into the muscle, which is where you want it to go. It's usually a few shots, takes no more than 2 to 5 minutes for the whole treatment.
How many units would you say that a man typically would need for a facial correction?
Usually at least 50 units. Some men require more, up to 60, 70 units, just because their muscles are that much thicker and stronger.
Okay.
And it still looks natural. It's not going to make you look more feminine. It's not going to change the shape of your eyebrows. All you'll notice is when you raise your eyebrows or make these facial expressions, you just don't see the wrinkles anymore.
Sure.
Ooh, all right.
All right. So have you raise your eyebrows one more time and kind of relax. Relax. And you'll see a few little bumps here where I put it, but those go away after about 10 minutes.
How does that feel?
It's exactly like she said.
Exactly like she described.
Yeah, a crunch and a little bit of burn. It's not bad.
Squint here in the middle and relax again. It's hard to do it when I'm on demand. Good. All right, just a few on the eyes and we'll be done.
You're doing great.
All right, squint your eyes. And
Like
relax.
that?
Uh-huh. Just do one on each side. So that down. You usually say wait about 3 to 7 days before you start to see it kick in. Give it a full 2 weeks though to the full effects. Mark it, won't be done. Exercise today, and then if you are washing your face, just be careful. Just wash gently. Don't rub too hard.
All right.
And that's it.
And he still has to put the kids to bed and do the dishes.
Yeah.
Okay, great.
All right, how you feeling? What was it like?
So it was pretty much just like you said, a little bit of a sting, a little bit of a crunching sound. Really wasn't bad.
And if you're interested in the Botox treatment, please come and see us at Forsyth Plastic Surgery. Give us a call or visit our website.